This is Chapter 41, Gifted Children with Learning Disabilities by Linda Krieger-Silverman, facilitated by Amber Davis Corbin. Just an overview of Chapter 41, we're going to look at the introduction to children with learning disabilities, the most prevalent learning disabilities in the gifted, assessing twice exceptional children, dual exceptionality in the classroom, some strategies for success, and we're also going to view 2 Temple Grandin videos. As an introduction, how can a child be both exceptionally able and disabled? This is viewed as a contradiction in terms. However, occurrence of learning disability in the gifted population is at least, if not more prominent than in the general population at 10 to 15%. Preliminary investigation suggests that the risk of learning disabilities increases as a function of IQ scores. Children with the highest IQs have been known to have attention deficit symptoms, sensory integration issues, reading disabilities, writing disabilities, autism, or a combination of disabilities. Hindrances have occurred due to the common perception that all giftedness depends on academic achievement. Hagen suggests that in order for an individual to receive placement in a gifted program, they should demonstrate academic achievement because it is the best predictor for future success. It is not likely that an underachieving child with an undefined learning disability be placed in a gifted program. Instead, they are labeled as someone who is lazy, lacks discipline, is inattentive, and lacks interest, all because they have an undetected learning disability. Oftentimes, attention is paid to their deficiencies rather than the development of their gifts and talents. Continuously being seen as treated as unintelligent leads to low self-esteem and lack of discovery and development of their own intelligence. Although parental advocacy, public awareness, and federal legislation have come a long way in recognizing disabled individuals, there is a large number of disabled individuals who remain defenseless. I included a quote over at the left, and it says, "It is possible for giftedness to coexist with nearly all disabilities, even retardation." Twice exceptional learners become casualties of a system that refuses to acknowledge their existence, fails to identify them, and does not support their strengths or assist them with their weaknesses. The most prevalent learning disabilities in the gifted are sensory integration dysfunction, attention deficit hyperactivity disorder, which is known as ADHD, auditory processing disorder, visual processing deficits, dyslexia, and spatial disorientation. Sensory integration is the organization of sensation of the brain's ability to construct meaning of an experience. When an individual has sensory integration dysfunction, they have difficulties with fine motor skills, which is writing or drawing, gross motor skills, riding a bike or catching a ball, or sensory modulation, which is intense reactions to sound, touch, light, smell, and taste. The most common signs of sensory defensiveness are physical awkwardness and lack of muscle tone, not developing hand dominance before school age, and inability to cross the midline. Symptoms of sensory integration dysfunction tend to be subtle in gifted individuals. This disorder describes the underlying reason for why educators see individual students who are incredible athletes but cannot write, others who have physical coordination but are constantly experiencing sensory overload, some who flinch at the sound of a vacuum cleaner or squint because of bright lights, or some who chew on their clothing, all because they are overstimulated or understimulated. The ability to integrate and make sense of sensory input is the neurological foundation for most functions. Sensory integrative dysfunction are the basis for many, but not all, learning disorders. There are 2 types of attention deficit hyperactivity disorders. There's the hyperactivity/impulsive type and the inattentive or distractible type. Highly active boys are most likely to be labeled with this syndrome. The inattentive type of this disorder is likely to be overlooked because these individuals are not a disruption by extensive movement. This disorder is highly controversial because of the number of gifted students who are labeled ADHD and placed on medication. Many wonder, is it ADHD or giftedness? Gifted students with ADHD have been found to be cognitively more advanced than other gifted individuals, but they are socially and emotionally more immature and have poor self-regulation. Gifted children diagnosed with ADHD can concentrate for long periods of time in their area of interest or intelligence, while remaining well behaved and attentive in one-on-one situations with an adult, but at other times are not able to focus and control themselves in the classroom. Hyperactivity forms of ADHD are noticed prior to age 7. Inattentive types may not surface until junior high or later. These are extremely hard to diagnose, particularly in gifted girls. Children with undiagnosed ADHD are likely to be friendless because they have a hard time reading social cues and are not good at self-monitoring. It is possible that gifted children are more at risk than other sensory integration and inconsistent attention due to birthing issues. A high incidence of birth complications has been found in the case histories of 600 exceptionally gifted children. Learning disorders of gifted children are best supported through early intervention during early childhood to ensure optimal development. The next disorder we're going to talk about is auditory processing disorder. This disorder is commonly associated with repeated chronic ear infections, or otitis media. Children with more than 9 ear infections in the first 3 years of their life are more likely to experience difficulty contributing in class, comprehension tasks, learning phonics, and succeeding in regular school activities. These are hard to diagnose in gifted children because these children often have a higher pain tolerance and usually are able to compensate well enough to exceed in primary grades, but usually are irritable for many other reasons besides having an ear infection. Their hearing may appear fine, but their listening skills are impaired. There is an overlap of symptoms of auditory processing disorder and inattentive ADHD. Gifted children can mask severe auditory weaknesses. They learn to speak within appropriate age norms. Abstract reasoning allows them to fill in the missing sounds with high accuracy. These individuals rarely exhibit the type of language difficulty seen in children of average intelligence. Common behaviors of individuals with auditory processing disorders are fluctuating attention, ask for repeated questions, copying others, mispronouncing words, difficulty remembering instructions, speaking loudly, turning up the volume, or covering their ears in noisy settings. These individuals excel in oral communication but struggle with written expression. This can be attributed to poor handwriting. Visual processing deficits. High abstract reasoning can disguise visual processing weaknesses. Gifted children are able to talk their way through visual tasks or verbally interceding through the task when they lack visual efficiency. The symptoms are not obvious in a classroom setting, but become prominent to an observer during individualized assessments. According to Hellerstein, symptoms include double vision, blurred vision, rubbing or closing the eyes, sitting very close to the television, or placing one's face very close to a book, fatigue and headaches during sustained visual tasks, omitting letters or words, losing place when reading, difficulty copying from the board, difficulty writing and spelling. These symptoms interfere with an average learner's learning. However, a gifted individual with visual difficulties often succeeds in the early grades and goes undiagnosed. When early readers suddenly stop reading when the print becomes smaller, this is a true sign of vision stress. If a child continues to read with increased font size, a vision screening is needed. Additional testing other than a typical visual exam is necessary for determining if a child's eyes are tracking correctly, are able to fixate accurately, fuse information from both eyes in a single image, focus efficiently, and have enough flexibility to support learning. Dyslexia. Dyslexia is characterized by phonological impairments associated with an assortment of processing deficits. Since reading relies heavily on the left hemisphere of the brain, experts have suggested that deficits of dyslexics are accompanied by visual spatial strengths. Normal visual spatial learners are able to think three-dimensionally, enabling perception of a form in space from many different angles. However, visual spatial abilities interfere with early mastery of reading because some dyslexic children see letters or numbers in 3D. They easily confuse the letters B, D, P, and Q because these letters are the same form, simply flipped or rotated. Albert Einstein, Thomas Edison, and Leonardo da Vinci all had symptoms of dyslexia. Davis and Marshall concludes that this is not a coincidence. The same mental thought process that give rise to geniuses also are at the foundation of dyslexia. These individuals think mainly in pictures and have vibrant imaginations. They solve problems in their mind, so it is impossible for them to show their work. Dyslexia can lead to high levels of creativity. Unfortunately, their giftedness is unseen due to their deficits. Dyslexia is often coupled with dysgraphia, which leads to problems in spelling, calculation, rote memorization, auditory short-term memory, and language mechanics. These individuals are able to succeed in life due to technological advances. Their extraordinary visualization abilities are crucial for advancements in STEM. I included a quote. It says, "Educators are often so preoccupied with a child's failures, they simply do not look for sparks or extraordinary potential." Spatial disorientation. This involves an inability to negotiate space adequately. Males tend to excel at making mental maps and can usually retrace their steps in unfamiliar settings, whereas females tend to pay more attention to details and are less likely to create visual spatial schematics in their minds to orient themselves. Children with this syndrome struggle with visual spatial organization, nonverbal problem-solving skills, and psychomotor efficiency. They find their strength in decoding written language, spelling, verbal classification, and verbal output. Gifted individuals with this disorder are known to be whizzes with words. However, they miss social cues, are clumsy, lack mechanical aptitude, are lost easily, have poor visuals and tactical perceptions. They have difficulty with adaptation and rely on verbal rules of conduct. In order to identify a nonverbal learning disorder, visual processing deficits must be ruled out first. Spatial strengths and spatial deficits can coexist. Gifted individuals with Asperger's syndrome may perform well on a visual spatial reasoning portion of an assessment but be unsuccessful at putting together a puzzle. These children place pieces of the puzzle by their shape, failing to notice that they place the lips of a person above their nose. Minor spatial weaknesses are common in gifted populations, but serious weaknesses are a sign of neurological disorders and lesions. These should be diagnosed with a complete neuropsychological battery. Assessing twice exceptional children. Gifted individuals are more complex than others, and their weaknesses are hard to diagnose. Oftentimes, when a gifted student's weaknesses are subtracted from their strengths, their potential is not appreciated, and they are seen as average. Unfortunately, few professionals have sufficient training and experience with both exceptionalities to be able to interpret their complexities. It takes a good detective to ferret out the gifts as well as pinpoint the deficits.